Hi, my name is Dr. Brian Klepzig, and if you're considering coming to our office for evaluation and treatment, you're probably interested in understanding what it is that I do and how I do it. What I do is a little difficult to explain and have it make sense. So a brief explanation and a demonstration, I think, will help you have a better understanding of what to expect on your first visit to our office. So I'll give you my 30 seconds, which is I'm a chiropractic physician. That's my Western medical training. I'm also a licensed acupuncturist, so I tend to think about things in terms of energy medicine as well. Board certified in clinical nutrition and I also practice as an herbalist. So in Chinese medicine, your body is just a bunch of batteries. All your big internal organs are all batteries that hold an electrical charge, and when they're charged up and wired together, you're nice and vital. And it's our vital energy that protects us, allows us to maintain our health, and helps us heal when we get sick. So in our culture, we generally don't talk about vital energy. No one walks into my office and says, "Hey, doctor, I am running out of vital energy. What can we do to fix that?" No, we come in with a diagnosis, more of a Western medicine approach. But in my mind, I'm not so much interested in directly treating the condition you develop, but I'm looking at your body holistically and using not only Western medical concepts to understand the physiology of what's happening with you, but also tying that together with Eastern medicine and energetic medicine. And so my evaluation technique is a little bit different because it's based on energy medicine, but it is a complete holistic evaluation where I go through and check all of your big or internal organs, and I find out where you're leaking energy. And we get that down to just one organ, gland, or tissue. And from there, we can start to try to build your systems back up. Everyone that comes in to see me has a chronic health condition. It has multi-layers to it. It's been going on for years. And we need a system that I can utilize that is very systematic and will get us to basically a functional medicine diagnosis, a holistic. It is a process. It takes time. People who come in to see me should expect to undergo treatment for 6 to 18 months. Depends on how long you've had the condition, how your body's compensated over time, how much of your vital energy you're still retaining. And so let's get on to a little bit of demonstration so I can give you a little bit of a better idea of how I do what I do. So the diagnostic system I use is my system. It's called Applied Bioenergy Analysis. It's something that over the years I created on my own as I was the longer I've been in practice, which I started in practice in 1997. You run into very difficult cases, and essentially almost everyone that comes into the practice these days, it's a very complicated health history and is a difficult health condition to deal with. And so over time, put together this system of diagnosis and call it applied bioenergy analysis, which I did teach for a few years to other practitioners. So it is a very detailed, sophisticated system of energetic diagnostics that will uh, get to the core issues that are causing your health condition. So the way it works is it's based on reflexes in the body. So, if you go in to see the doctor and they do what's called a patellar reflex, where they use a little hammer and they tap your knee and your leg jumps, all I'm doing when I do my technique is using a slightly more sophisticated autonomic reflex where I will be pulling on your arm and feeling for the strength of the muscle, which is more the tone of the nervous system affecting the muscle is more what I'm looking for, because I'm going to use my test kits to elicit a neurological response that's automatic or autonomic coming right off of your body's brainstem. And so essentially all I'm doing is asking your body a series of yes or no questions to work our way through the diagnostic process. We all have a basic idea of how a computer works, right? You type information in, You hit save, you come back later, and you can still find the information. And it's coded electronically, digitally imprinted onto a computer disk. And so the way that my test kits, the test kits that I utilize, work is that water can retain resonance or that digital information the same as a computer disk. So my test kits I have manufactured and they're digitally imprinted with them. It's water digitally imprinted with information. And so all I can code just about anything in. I start with the basics, which is all of your big internal organs and glands and tissues, because those are the tissues and organs that hold the most energy, most vital energy. There's a reason why your heart and your spleen and your liver and your kidneys and your lungs are called vital organs because they are vital for you to be able to survive and live on a day-to-day basis. But they also provide the majority of our vital energy, especially our hormonal system. That kind of is a component that drives our vitality. But the test kits themselves look like this: just purified water that's been digitized with information. And so what I do is lay the vial test kit on your abdomen, pull on your arm, and I touch vials one at a time. I get a yes or no answer to the question I'm asking, because literally that's what the vial is asking your central nervous system to respond to a yes or no question. And once we work through a complete process and wrap up the exam, we'll know where your primary weaknesses are. So the actual technique, which I'm going to demonstrate now, is pretty fairly straightforward, easy to do, and non-painful. So let's get started. Let me show you what it is that I do. So I have a patient here on the table in front of me. I'm going to ask her to take her left arm and put it flat on the table for me. Now I'm going to use her right arm, and we're going to go nice and straight with it, elbow as straight as we can. Always keep that locked in. And what I'm going to be doing is pulling in this direction. She's going to resist me back this way, and we're just basically going to match my pressure until I can feel that the shoulder is nice and solid and locked in. Then we're going to take our test kit that we talked about earlier, and I'm just going to use you or my patient as a table to operate from. And as I'm pulling on her arm, I'm going to touch these vials one at a time. And if I get to a vial where her arm clearly goes weak and we get that neurological inhibition that I'm looking for, that tells me that that is a tissue that we need to pay attention to in our evaluation. And we just keep repeating this process over and over until we come up with a solution for your health condition.